Sanibonani Mzansi. I am your host Candice Kumalo and I welcome you to another episode of the Health from Mzansi podcast. Have you ever wondered what your baby is up to inside the womb? Well, today we're taking a dive into the fascinating world of fetal MRI. Joining us is radiologist Dr. Lauren Raubenheimer, who explains how this amazing technology offers a window into your baby's development, providing detailed images that can be crucial for both diagnosis and a peace of mind.
So my name is Dr. Lauren Raubenheimer and I am a radiologist. What I specialize in is fetal MRI imaging. So that's my area of special interest. I do most of the reporting for the Western Cape, all the fetal MRIs that take place here, as well as I'm also a general radiologist with a special interest in neuroradiology and pediatric radiology.
Thank you so much for that lovely intro, Dr. Dr. Lauren, can you please just explain what fetal MRI is and how it works?
Basically, MRI stands for magnetic resonance imaging, and that's really using a magnet to obtain images of the body. So it's not like CT or X-ray, which uses radiation. It uses magnetic resonance to obtain images. It's extremely complicated physics, which I won't bore you with, but it does make it a very safe way of obtaining imaging. And then fetal MR in particular allows us to have a look at the baby when it's still in the mother's stomach. So what we do is we scan the mother, but then we focus on the baby and we can see all the details. We can see the uterus, the placenta, the umbilical cord, and then all the baby's anatomy, so the baby's brain and body.
I'd also just like to find out why it was developed and what are the potential benefits of fetal MRI.
MRI, it's always been hoped that we can look at the fetus using MR because it's a safe modality. So because it, like I said, it doesn't use radiation, it's very safe for the fetus. And it also gives us really beautiful images. So the hope was that we could look at the fetus with MR, but previously it was very difficult because I'm not sure if you've ever had an MRI, but they ask you to lie completely still. And if you've ever had a baby in your belly, you know that babies do not lie completely still, and it's impossible to ask them to. It's always really difficult to get good images. But luckily, with all the progress with the MR machines and all the sequences that we perform, we're now able to do super fast sequences, so we can do them in a few seconds and we can hopefully catch the baby just as they're still, just for a few seconds. And the reason really we wanted to explore fetal MR is because there are times when ultrasound images are not optimal. So for example, if the mom has a really high BMI, often that means that the ultrasound pictures are really not great. If the mom has a condition where the amniotic fluid volume is quite low, it also makes it very difficult for the fetal medicine specialist to have a good look at the baby. And there are also certain structures we just see better with MR. So for example, in the brain, the folding of the brain that takes place during gestation, and also looking at certain areas of the brain where later in pregnancy as the skull begins to harden, difficult for the ultrasound beam to penetrate that bone. So there's certain areas of the brain that we just see better on MRI.
So I know you've just touched on it a bit, but in more detail, how does fetal MRI differ from ultrasound?
Yeah, so ultrasound really is the workhorse of imaging a baby before they're born, and it will always be the number one screening tool. It uses sound waves rather than magnetic frequency to obtain images, so it's also very safe. And the baby is imaged in real time, so the doctor can see the baby moving, stretching their limbs, swallowing while they're having a look, which is very helpful. But like I said, there are times when ultrasound images just really don't give us all the information we need. So MR is helpful in certain circumstances. So when an abnormality is detected on ultrasound, then an MR is often ordered, and it just helps give us more detail to see the abnormality. So it's really an adjunct to ultrasound in certain circumstances.
So when would you say fetal MRI is recommended and why is it important at those stages?
So most of my referrals come from a fetal medicine specialist. So the baby has gone through the routine ultrasound screening that happens during pregnancy, and they have picked up an abnormality. Usually that happens at the detailed scan. So usually at about 20, 22 weeks, babies are referred for what they call a detailed scan. And that's the ultrasound where they look really carefully at all the structures. And often that's the first time they pick up if there's an abnormality. And then the baby is referred on for an MRI to have a look at what's been picked up and also to see if there's anything else that wasn't detected on the ultrasound. So this is usually done in the second trimester, but we can also do fetal MR in the third trimester if an abnormality is picked up later or if we're just following up something that was picked up earlier. We don't do fetal MR in the first trimester because the baby is just too active. The things are too small to see well. And the research really isn't there that it's safe to do in the first trimester, although it probably is. The second and third trimester are when we do fetal MR at the moment.
I think it's important to also find out if there are any harmful effects associated with fetal MRI, or is it safe for both the mother and baby?
Yeah, so that's obviously an excellent question. So anyone who images or cares for unborn babies is really careful that whatever we do doesn't harm either mother or baby. So fetal MR is safe. So there's really no documented evidence of any effect on the developing fetus. We never give the mother intravenous contrast for a fetal MRI. And in the past, there have been sort of theoretical concerns about tissue heating. So, magnets, sometimes the tissues heat up, and also the noise. If you've ever had an MRI, you know that it's a really noisy experience. But we really stick within very strict parameters. So the machine monitors both the tissue heating and the acoustic noise that the fetus is exposed to. And we keep these within really tight parameters. And therefore, there's really no evidence of any deleterious effect on the developing fetus.
So in closing, what advice would you give to parents considering fetal MRI and those who may be unaware of its importance?
What fetal MRI is it's an indispensable tool to complement ultrasound in the workup of an abnormality. Usually, if an abnormality is detected, often by a fetal medicine specialist, which is a gynecologist obstetrician who has had special training in fetal medicine, then they're referred on to an MR. And I would say the advice I would give is that it just gives us so much more information, both about the abnormality that has been detected, and also we're often able to detect other abnormalities that weren't seen on ultrasound. And this really is important when we're thinking about prognosis and we're giving parents advice in what is a very difficult situation. It can also give them more information which will help plan things like when the baby should be born, how the baby should be born, where the baby should be born, and if they are going to need any specialist neonatal care.
Thank you for joining this week's episode of the Health from Zanzi podcast. To find out more about being the healthiest version of yourself, visit healthfromzansi.co.za, or you can send us an email to hello@healthfromzansi.co.za. This is the Health from Zanzi podcast, and your ears are always invited. So there you have it. Fetal MRI is a valuable tool that can provide incredible insight into your baby's health before birth. While it's not a routine part of pregnancy for everyone, it can offer peace of mind and inform crucial decisions for families facing potential complications. Stay healthy and fancy. I am your host, Candice Khumalo. Until next time.